So thank you. So this is my first go at Teams Grand Rounds. So we're gonna see how it plays out. But I'm really hoping to have some conversation at the end and actually some very real and timely action steps that we can all take. So there's nothing hypothetical about the need for really engaging right now. So here we go. I'm going to go to sharing my screen. Are you seeing how can the COVID crisis improve our children's health? Okay, good. So the question is, what can we learn from this crisis in order to solve the larger looming climate crisis? How can we really make the opportunity out of a crisis? And that's what the whole theme will be about. I have no financial disclosures. And the kind of what I'll try to weave together in the next hour are the themes about, we've probably never heard more than ever in the past couple months about flattening the curve, and we really understand that now in a new way. And so we're going to talk about what that means for climate change. And one way that climate change and COVID-related mortality are related. I'll speak about the U.S. call to action on climate health and equity and what that is and why over 150 medical organizations have co-signed it. This is a little bit in jest, but there's some real pearl to it, is why Greta Thunberg cares more about how you vote regarding climate than if you're a vegetarian and drive a Tesla. And most importantly, what the opportunity is for us in this really critical moment of history to safeguard our children's health based on how we respond to this crisis. So I am with you here, and we are all part of a lineage of being society's healers. And we're the only profession, we're really unique, that we take an oath to do no harm and that we're dedicated to health and healing. And I'm here to talk with you as that kind of society healer role about climate change because it is affecting our health. And this is a quote from the director of the World Health Organization, that the Paris Agreement to limit global warming is potentially the strongest health agreement of the century. It's not diabetes, it's not heart disease, it's climate. And I think kind of the North Star of really realizing that everything that addresses climate change is a health intervention is what we'll talk about in the next hour. And the AMA agrees. So last year, the AMA adopted policy calling for filling this knowledge gap because climate change is sort of emerging. It's been emerging for a few decades, but it's an emerging public health crisis that even in the face of COVID, climate change looms greater as a public health crisis than COVID does and is irreversible. So that's why the AMA is calling for medical education like this across our kind of medical education continuum. And that's, I'll just touch a little bit on the science because probably we know enough of the science, but it's really how do we engage that we'll focus today on. So a lot of the discussion around COVID is kind of how it affects, the elderly among us are at greatest risk for getting sick and mortality from COVID. And so there's this sense that what we're doing collectively is protecting the most vulnerable among us. And for many, that's their parents or their grandparents and kind of protecting them, whether it's not going to the grocery store or things like that. And in the face of climate change, it's actually the opposite, that in contrast, it's our children who 88% of the burden of disease attributable to climate change is affecting our children already. And that's from the World Health Organization in terms of complications like heat, stroke, heat illness, diarrheal illnesses, especially in the developing world, asthma, things like that. And this is today where the global burden of disease lands on our children but across their whole lives and their children's lives and all those to come, the burden of climate change, which unfortunately is invisible and slower moving, is landing on our children. So really, this, for me, like Dr. Lim was saying in the introduction, climate solutions are protecting our kids. And so that's what it's all about. And I think we really can feel, I've had so many patients say, I don't really care about myself, but I just want to protect my mom. And we can transfer that to the discussion around climate change, that it's less about us and it's really about who we love most, which is, our children and the generations to come. This is my specific representation of the generations to come, and she's too. And all of the climate projections are going to play out across her life. And actually, the Lancet Commission, the report last year said we have to act on climate now to prevent every stage of life of the children born today from being defined by a changing climate. And that's what my motivation is. She is. So I don't know if this is going to work, but I think it'll be fun to try. And Marina, if you could help. So I'm hoping that people would be willing to write in the chat right now why you're spending this hour talking about climate and COVID with me. And if you could write one of your reasons for joining and what concerns you about climate change in the chat box, I would love it if either Dr. Lim or Marina, you could read a couple out.
Maria says it's a health crisis.
Absolutely. Who said that? You should be talking. You
Maria.
Okay, yeah, you did. Okay, good. Maybe just a few others.
It's a threat to biodiversity. I listened to my 13-year-old talk about how she'll probably die when she's in her 40s because there won't be a planet left for her. Kyoko says that. It's pretty bleak. Yeah. Worried about our kids, our children. For my kids, for all the innocent people, animals, plants who will be decimated for no fault of theirs.
Yep.
Maureen Park says, I love animals.
Yeah, me too. I think that really brings up for me what the issue is that those least responsible for climate change are harmed the most, both today and in the future. And really, one of the key messages I want to try to share today is how incredibly powerful we are being part of the Permanente Medical Group, which is actually the largest medical group in the most powerful country in the world. And the more that we frame climate as the health crisis that it is, the more approachable solutions are going to become politically, because everybody can really relate to wanting to protect the health of our kids. So there's so much influence in this, in our medical group, and that's one of the things I want to kind of build the organization and the sense of solidarity, is working together to protect the interests of who everybody was just putting as their motivation. So thank you. That was an experiment. I think it went pretty well. So we not only, in our kind of hearts just wanting to protect the vulnerable among us, but that's actually our mission. So there's a nice alignment to improve the health of our members and the communities we serve. And this is, as COVID has shown us with public health crises, whether it's viral or ecological, we're only as healthy as the most vulnerable among us, and our health is totally interdependent. So we can't really take care of health, in an isolated way with just single individuals. It's really about the community, and it's about collective solutions, which I'll talk more about. There we go. So flattening the curve. Really this is about kind of upstream prevention to prevent the systems from being overwhelmed. So the parallel, you can probably remember the first time you saw this curve, referring to the need to flatten the curve so that we didn't run out of ventilators, basically. And the protective measures, can you guys see my mouse? Does that work?
Mm-hmm. Yeah.
Okay. So protective measures are not telling individuals to, wash their hands. These protective measures are policies like sheltering in place to have collective solutions, collective policies for collective problems. And we're here in Northern California. We're staying in the blue, which is great, but we're not staying in the blue in terms of the climate curve. So the parallel here is time on the x-axis and global temperatures on the y, and this instead of the healthcare system capacity as being the line we want to stay under, this orange dotted line represents the Paris Climate Agreement goals, which is to limit global warming to 2 degrees Celsius, because beyond that, basically in summary, the tipping points for kind of positive feedback loops of ice melting get out of control, and the planet we know it, as somebody said in the chat, will not be the same for in the years ahead. So these climate protective measures that can flatten this curve and keep us at safe temperatures so that our children have a sense that having kids of their own is a good idea, is not telling people to drive a hybrid. It's not individual people getting solar. It's system-level policy changes to shift our economy from a fossil fuel-based one to a zero-carbon clean energy economy. And these are the policies, just like shelter in place is a policy to flatten the COVID curve. In order to flatten the climate curve, we need policies to divest from fossil fuels and invest in clean energy to stabilize the Earth's climate, basically. This is no small task, which is why it's kind of paralyzing, and we need collective solutions. So this is kind of the extent of the science I'm going to get into, because I think we all have a sense, enough of a sense of what the problem is. It's more what to do. But in brief, burning fossil fuels, whether it's coal, oil, or gas, harms our health in sort of 2 distinct pathways. The first one is, say there's a diesel truck bringing us, imported goods from a port. The exhaust pipe of that diesel truck, about 12% of the emissions that come out of the exhaust pipe are CO2. And that carbon dioxide floats up into our atmosphere, where it lives for hundreds of years, and it acts as a greenhouse gas, trapping the sun's heat in our planet and making our planet a hotter greenhouse. That global warming effect directly increases air pollution because warmer temperatures promote kind of the chemical processes that make smog, which is also called ground level ozone. And then we inhale smog and ground level ozone, and we're at higher risk of dying from respiratory causes, more asthma flares, more COPD exacerbations, things like that. So that's kind of the longer term global warming pathway of how air pollution is related to just hotter temperatures. And then additionally, out of that diesel tailpipe come things called particle pollutants. So this is, it's like 1% of the emissions of a diesel engine, but they're extremely potent. And many people have probably heard of the term particle or particulate matter. It's also often called PM. 2.5 is like the smallest particulate matter, or nitric oxides. Other things like black carbon, which sound like something you definitely don't want to be breathing, but we are. And we're breathing them as we walk beside freeways, as we walk beside busy streets, as we live in cities. So as we burn fossil fuels, these particle pollutants are directly inhaled in our communities, and they increase our risk of all-cause mortality. the more we inhale particulate matter, the more likely we are to have heart attacks and strokes and get pneumonia and get sick. A lot like what you see from the side effects of smoking, but just in kind of lesser degrees depending on the exposure. So these are kind of the two pathways through which burning fossil fuels are literally killing us, and doing so to a greater and greater degree the longer we wait to kind of in earnest begin down the clean energy transition. Today, more than ever, the health impacts of particulate matter are really resonating as an equity issue. And just last month, Harvard did a study looking at the levels of kind of the background baseline levels of particulate matter air pollution across 3,000 counties in the US. And then they looked at COVID death rates. And what they found is even, this is 1 microgram per meter cubed, even one teeny unit higher of average PM 2.5 exposure. So this is like you live beside the Port of Oakland versus you live in the Berkeley Hills. That's the kind of difference we're talking about. Results in an 8% increase risk of dying from COVID because of that background exposure. And many of us have heard that, now's a great time to quit smoking because smokers are having higher mortality risks related to COVID. And this is sort of, it's not exactly the same, but it's a very similar pattern. But nobody gets to choose what their neighborhood's pollution levels are versus smoking. At least you can decide yes or no. But this is absolutely something that is kind of exacerbating the health equity issues that we already have through air pollution exposure, and then who's getting sick and actually dying from COVID right now. And this is further kind of visualized. This is a study that was done a couple of years ago now through our Kaiser patient records were reviewed, and then there was traffic-related air pollution measured on a block-by-block level for West Oakland. So this is the Bay Bridge over here. This is the Port of Oakland down here, Lake Merritt right here. And these freeways are carrying, diesel trucks primarily in and out of the Port of Oakland. There's tons of traffic on these freeways. And what the study found is that based on just higher traffic-related air pollution levels for living closer to these freeways with fossil fuel emissions of diesel and gas cars, trucks, that we could measure, you had a higher risk of dying from a heart attack if you were 65 or older based on kind of living closer to these freeways. So again, this is sort of a similar map to what we're seeing from dying from COVID. So just the take-home message is that the background air pollution is setting us up to get sicker from whether it's heart disease or COVID. And I see this really as also a map of socioeconomic status and equity. That this is not our, well-educated Berkeley professors who are living beside the freeway in West Oakland. This is already the most vulnerable among us in terms of socioeconomic status and also health status. And then they're getting sicker because of where they live and the air pollution from the fossil fuel kind of cars driving by. So I'm not going to go into great detail on this, but suffice it to say that climate change is a health risk multiplier. And that's actually part of why it's so hard to grasp for the public, is because it is making everything, well, not everything, but most things a little bit worse, right? So obviously air pollution I've been talking about, asthma, allergies, here extreme heat, more like in the Fresno and Southern California area, increasing our risk of dying in heat waves and just average higher temperatures. The higher temperatures and the risk for wildfires is something that's all too personal for us here. Additionally, the power shutoffs that we are having happen to lower the risk of wildfires, but then what does that mean for people who are already medically vulnerable and who rely on electricity at home? So I'm going to leave it at that, and really just kind of focus on the air quality aspect of climate change, because it's a really good proxy. And I think that's captured really well in this quote by one of my idols, Christiana Figueres, who pretty much brokered the Paris Climate Agreements. And the way she said it, I think really captures it well, that today we have 9 out of 10 people breathing bad air. By the time we get to the point where 10 out of 10 people are breathing good air, we will have addressed the roots of climate change. So sometimes it can feel so complicated, but if we just focus on improving our air quality, we will be addressing climate change. And really what that means is transitioning from dirty fossil fuel energy to clean, renewable energy, zero carbon energy. That's a nice way to simplify it. So I mentioned at the beginning this document called the U.S. Call to Action on Climate, Health, and Equity. And it's a policy action agenda, has 10 policy pieces, which over 150 organizations in the U.S. have, medical organizations have signed kind of in agreement. The AMA, the CMA, American Public Health Association, American Heart Association, many organizations that we all look up to and probably are part of. And it starts out saying climate change is one of the greatest threats to health that America has ever faced. And this is still true even in the face of COVID. You know, COVID will be relatively shorter lived, but climate change is this irreversible kind of, slow moving, but more irreversible public health crisis that, like I said earlier, many of us kind of raised is what we're leaving for our children. So the first, I won't go into all 10, but the first policy action step that we have all kind of agreed to in this action agenda is transitioning from fossil fuels to clean, renewable energy. And luckily, there are immediate health co-benefits of the climate solutions that we need to implement. And, there's many, whether it's the air quality improvement, like we're all seeing right now. Air quality is better than it's been in the U.S. In decades because people are driving fewer fossil fuel-based vehicles. The other kind of solutions that are climate solutions, which one day we'll get back to, are promoting things like public transit, where there's more active transit involved, which actually we have quantitative data about reducing the risk of heart disease and diabetes from, less sedentary transit and kind of commuting patterns. And then other health co-benefits of climate solutions are things like changing our food supply, eating lower on the carbon footprint food chain, things like that. So this is not just going to help our health in the decades ahead when my daughter is retiring, when your children are in college. This is going to help our health immediately as we implement solutions that address climate. And right now, what we'll talk a lot about at the end is the notion of kind of our COVID recovery and what kind of principles and priorities do we use as a guide for how we invest the COVID recovery and stimulus packages. And there's a large movement calling for what's called a just recovery, which really is about putting people first, and really kind of making the investments that we use these stimulus packages, make our society more fair and makes health more of a priority, even above profit. So I'll talk more about that at the end. So does anybody here know Dr. Imelda Dacones, or her name? I don't know if you can't unmute yourself. You can put it in the chat. It's kind of rhetorical. But she's basically Rich Isaacs of Northwest Permanente. And she wrote this article in Permanente Medicine, which you probably read, titled "Climate Change is in Our Lane" as physicians, which I really, really appreciate, because sometimes, we have this like apolitical training, but it's actually not in the interest of the health of our communities to shy away from politics because the industries and interests that threaten our public health are not afraid of politics. So really we need to kind of fill the void and speak for public health in a really organized way in order to fulfill our professional obligations, really. So this is a picture of Dr. DeConis. And just a couple of highlights. She said climate change is about our health, which the late Mr. Tyson also, he boiled it down to that a lot. And then what Dr. DeConis also said is that because of the COVID pandemic, we've really realized the need for redundancy in our supply chains and the need to place our vulnerable populations front and center to address kind of the equity issues, and how any public health crisis, whether it's COVID or climate change, demands that we kind of use these principles as our guide. So big shout out to Dr. DeConis. She's also the chair of the Permanente Federation, which all of our 8 Permanente medical groups are part of. So, Dr. Snow, talking public health. We'll go all the way to the beginning. Who was a physician, and in the mid-1800s, he has so much more fun when there's a conversation, but he used epidemiology. He's a father of epidemiology and public health, really, because he identified that there was a cholera outbreak, and what he used, he did case tracing, just like we're doing today, to find that there was a well in London where all the patients coming down with cholera and dysentery were drinking from this one well. So the most elegant and effective solution to take care of his patients was that he showed kind of his scientific reasonings to call for the city council to take the handle off of this well, because that was the real root cause treatment for the outbreak. And then here we are today with COVID, and similarly we're trying to go upstream. We can't really go to the root cause at this point, but the same kind of policy level solutions are the shelter in place and maintaining social distancing, things like this, to prevent COVID from spreading. And then the other parallel that I see is going upstream, is going to the root of where we're getting fossil fuels out of the ground, whether it's a pump jack for oil or it's a coal mine. We can either treat all the asthma and heart attacks and premature deaths downstream, or we can organize our medical voice, which is uniquely trusted. I'll right now mention that in the U.S., the most trusted professional voices are nurses, and then the second most trusted are doctors. So we really have the market cornered on trust, and that's for really good reasons, because we've taken this oath. So what we need to do is to leverage that trust in the interest of public health and safety, and to really make fossil fuels clearly the health threat that they are, with a very, very good, ready alternative, which is clean energy. I don't know if anybody saw, this is like, I'm going to celebrate this weekend. Yesterday, the New York Times, for the first time ever in the U.S., there was more energy produced by renewables than coal, which is huge success. And we need to use our voices to, to frame that as a public health win, because it is, and to continue that trend. So this also brings me, I've talked a lot about public health, and we're all talking about public health more than maybe ever, and the social determinants of health. It's a hard thing to measure, but roughly we think that 80% of our health is determined by the environments we live in, the policies that guide the environments we live in, the systems we live in, the social determinants of health, and something like 10 to 20% of our health is determined by actual direct medical care. And I think this is what ties these all together for me, is that these are all upstream, right? This is not about individual treatment. This is not about one person washing their hands. It's not about the person with dysentery getting their water from a different well. It's about system solutions for really collective problems. And so for the system level solution for the cholera outbreak, when Dr. Snow was trying to stem the tide of infection, was removing the pump handle. And then for us today, flattening the curve for COVID is sheltering in place. And for the climate crisis, really the solution is divesting our economy from fossil fuels and investing or transitioning to a zero carbon economy. So everybody loves a good cartoon. And this one of Earth fighting COVID, and then the large looming heavyweight being climate change getting ready to come in, I think really, this is from The Economist, captures what I am most worried about and what we can learn. So what we learn from this fight, where we can learn and apply to the greater fight. So there's a lot to learn. Hopefully we do. So obviously, an ounce of prevention is worth a pound of cure. Never rang more true than with COVID and climate. And then also, like I mentioned at the beginning, it's not about me or individual health. It's about us and collective health, and that protecting everyone's health really requires intergenerational solidarity, that we look out for people that are younger or older. Science matters, that our collective safety is protected by listening to scientists and doing so in a timely way to reduce, unnecessary deaths, really, and suffering. And that public health crises worsen pre-existing health disparities, absolutely. And this is the point of this talk, is that flattening the curve for public health crises require collective equals policy solutions that are informed by health advocacy. That this is about the social determinants of health. This is about the environments and the systems. It's not individual level choices. So, how do we flatten the curve with policies? One of the other objectives was in jest about Greta, and I think what Greta would say is she and I would guess all of us are really done with kind of the talk about climate solutions, and now it's about implementing policy action. And another cartoon of, we've talked so much about the flattening the curve, and here's the scientists, looking at this one, but the looming one is here, being climate change. And like I've already said, the shelter-in-place policies are flattening this curve, which is very important to not overwhelm the healthcare system capacity. But the larger curve that we need to flatten by reducing greenhouse gas emissions is through policies that divest our economy from dirty fossil fuel-based investments to moving them towards in transitioning to investing in clean, zero carbon, investments in infrastructure, because that's what's going to keep our kids safe and our kids healthy. So the famous lever, what do we have to leverage? We have our trusted voice as physicians and nurses, NPs, respiratory therapists. The health voice is really unique in our role in society. And it's hard won, we worked hard for it, but we can use it, and really the kind of the value that we can leverage is human health and safety and well-being, because no matter what your color politics, that's something that unites us all, is our desire for health and safety and well-being, if not for ourselves, at least for our kids, as a unifier. And I put this picture of a group of health professionals to really symbolize that this is all about collective teamwork through advocacy. It's not individual advocacy work. And then, like I mentioned earlier, we're the largest medical group in the whole country. We have 9,300 doctors in Northern California and 40,000 employees. So we are a hugely influential voice, and we can leverage that to kind of frame climate as the health issue it is, so that the climate solutions become something that the general public support, because they realize it's about their kids' asthma and their parents' heart attack risk. So this is not a policy, but it's a proposal that I've made a few times to Dr. Steve Perotti, who is Dr. Isaac's right-hand man for many things, including our COVID response right now, and government policy. And the proposal that I've made is kind of what the leadership kind of structure could be of making climate a strategic initiative within TPMG. And I've called it the 3 Ps of total performance in a changing climate. One is practicing for planetary health. So that's getting our own house in order and doing a carbon assessment, which we've never done, of our health, of our kind of workplace impact. The next is preparing for climate change. So we will need to adapt our medical model to be more resilient. And like Dr. Daconis's piece wrote, that's supply chain redundancy. It's many different things, and I'll give one example shortly, but we need to change our medical model in order to adapt to a different climate, literally. And then what I think is most exciting is the partnering for policies. And like I said 100 times, our solutions to climate are all about policies and collective solutions. And another way of putting that partnering for Paris is really partnering for reducing emissions. And in order to achieve the Paris climate goals, we have to half our emissions by 2030. That's only 9.5 years. And then we have to get to a zero carbon world by 2050, when my daughter will be about 32. So we have a lot of work to do, and it's totally doable. All we lack is the social will. And that's really where we come in, because the more we frame climate as a health issue, the more social will we will build. So to give some examples of what practicing for planetary health means, that means that our own work, our own kind of professional choices are not worsening the climate crisis. So our health plan colleagues have done a really knockout job of leading the healthcare industry really with their 2025 environmental stewardship goals. The first of which is being climate neutral this year, and they're actually in process to get kind of certified for that this summer, and then to improve actually to emit even less by 2025, and to kind of make our food supply sustainable, reduce our waste production, which we have a lot of work to do, especially now, and reduce our water, things like that. So this is all health plan, and they are making these choices based on the energy that are turning on the lights in our clinics and our hospitals. But they don't really have a partner in the medical group, because we don't have, none of our associate executive directors in TPMG have climate or environmental stewardship in their portfolio. And so that's what these 3P, this proposal is about, developing that partnership for our health plan partners. So one example, which our health plan partners helped us do, along with Dr. Alan Ansai, who's, I believe he's a regional anesthesiology chief, was changing the formulary for one of our anesthetic gases. And many of our anesthetic gases are super potent greenhouse gases. So if we put somebody to sleep using desflurane, it's like driving a Hummer for, 4,000 miles or something. And there's alternative anesthetic gases that have lower greenhouse gas kind of impact, but we have to make it a priority to choose the lower greenhouse gas kind of imprint formulary through the system changes of our formulary. So we have done that. We still do use desflurane and other things like nitrous oxide, which is also a super potent greenhouse gas. But the point is that we're reducing the use and we're phasing out desflurane from our formulary. So that's kind of an example of what we can do with our own medical practice within our walls. And the next is preparing for climate change and the kind of how do we care for our patients with the changes that a changing climate is bringing. So this is a proposal. It's not yet happening, but we all remember, especially last fall, the power shutoffs and how millions of people were affected multiple times of not having power for more than a day. And there's every reason to anticipate that this is going to be an ongoing pattern that we have every fire season, because global warming kind of sets up all the conditions for worse and worse fire seasons. So we also have a lot of patients at home on medical devices that require electricity. This is a patient at home with peritoneal dialysis. We also have patients with, CPAPs and oxygen concentrators and nebulizers and even ventilators, right? So what are they supposed to do when we don't have power for 3-4 days, multiple times this fall, especially with COVID, right? So we're going to have patients coming in seeking care in the ER because their home medical electric devices don't work, but then we also we're still going to be having the kind of social distancing requirements for the foreseeable future, which will obviously put a greater burden on our healthcare system. So just to share this idea of what does it mean to prepare our medical model, the notion of distributed power of solar plus a battery to store the solar power in people's houses can keep patients like ours that require electricity for their medical devices, keep them safely at home so they don't come in and get sick or get somebody else sick just because of electricity. And so there's actually a movement to, kind of make things like solar and battery storage something like durable medical equipment, where it's kind of part of caring for patients is electricity resilience in order to keep them safely at home. So that's one example. And then really what I'm going to kind of finish focusing on today is partnering for policies to address climate change. Just like we have policies of shelter in place to keep people safe from COVID and flatten that curve, we also have the opportunity to flatten climate curves through policies. So this is where the action steps begin, okay? So I have asked Marina to put in the calendar invite for this talk. I
actually already sent it out to the medical center this morning. So
okay.
Yeah.
So thank you. So this letter, there's kind of a lot of organizing happening within the medical community across the world, and we're hoping to make this the largest kind of mobilization of the health voice since the Paris Climate Agreements. And it's a letter, it's pretty simple, but it's we're right now looking for co-signers, whether individual healthcare professionals, which I hope you will consider signing, and I have emailed Dr. Taconis, Dr. Perotti, and others today to see if our medical groups can sign. And it's a pretty simple ask, you would think, but it's calling for health input, whether through the chief medical officers or chief science advisors of the leaders of the G20 countries, asking that health voices are part of putting together COVID recovery stimulus plans. So, I would hope that Speaker Pelosi, in her HEROES Act that she just unveiled this week, that there's been like a public health impact assessment, but I don't think there has been. And so what this letter is they're closing the co-signers next Thursday, and it's going to be delivered to the leaders of the G20 countries the Tuesday after Memorial Day, May 26th. So I would really, really love it. It's already been co-signed by the World Health Organization, AMA. I'm working on getting it from CMA and others, but it would be really, really valuable if you would add your name and then add, invite other health groups to also co-sign. So this is about the organizing for policies, which is the policy of having the health voice inform how we're responding to COVID and where we're investing our money. I'm going to skip this. So has anybody heard of the Rewind Act that was just introduced a couple of weeks ago? And it's the whole goal of it was introduced in the Senate. It has several co-signers, including Senator Harris and Senator Warren, and it would prohibit bailing out fossil fuel industry companies with the CARES Act, COVID relief money during the public health crisis. So what we really don't want to do is have our response to COVID exacerbate the next public health crisis by kind of furthering and extending the life of the fossil fuel industry when we really need to transition away from it and invest our money in things that are safer for our children and for our health and our communities. So that's what this is all about. And so Speaker Pelosi just introduced the second COVID stimulus package this week, I believe on Tuesday, something like $3 trillion. And what I'm hoping you could take the time to do today is to make a call to Speaker Pelosi's office asking that the Rewind Act be included in what Speaker Pelosi's COVID recovery package is called the HEROES Act. So we want Rewind in the HEROES Act in order to prevent our tax dollars from subsidizing the industry that is making our communities sick. So there's a Google form that Marina and Dr. Lim have shared, and I'll make sure is available. And if you would sign this form, I'm going to communicate that to our governmental affairs director, Liz Rothberg-Smith, to ask that TPMG considers advocating for this act because it's really a public health issue. So please do get your name on that if you'd like, and I'm going to submit it to our government affairs leads by it'll be next Thursday. I'm going to skip that for today. So if you want to stay in touch, I would love that. Like I said, this is teamwork, and we have a team on Teams, which is called the Green for Health newsletter. So there's a link that either Dr. Lim or Marina will share, but you can also go to Teams and search for Green for Health newsletter. And I share kind of updates and what I hope are useful pieces to learn about climate and health and equity every couple of weeks or so. That's one way to stay in touch. And then the opportunity, really, I can't say this enough, is for us to organize more within our medical group and then also our medical kind of community to frame climate policy solutions as health solutions in order to flatten the curve of the greater public health crisis being climate change. So, we're not going to win this fight with individual solutions. It's all about organizing our voices to changed policies. And one of the ways we can do that is, through the newsletter I mentioned and working together through whether it's CMA or your local medical society or the Permanente Federation. Kind of these are our organizing tools that we can engage in policy advocacy for climate solutions. And I think I'll leave it there to see if there's any questions. And I'll share out this action step toolkit kind of through, I don't know, Marina and Dr. Lim and I will figure that out. And if you want to be in touch, I would love that. This is the most important thing there is to me, this work. So that's my email, and please do be in touch. And I guess the last thing I'll mention is I do have a coalition that I'm part of called Climate Health Now, and we have a website that you could check out if you want, and that's for work outside of TPMG and Kaiser. Yeah.
Thank you so much, Ashley. That was so inspiring and scary at the same time. I think it's very eye-opening and not something that we commonly think about as in our, in our purview as physicians. So that's really, thank you for bringing that to light.
Yeah, my pleasure.